Good morning. Quick introduction. My name is Kerry Trotta. I'm one of the Medicare plan specialists for Health New England. We certainly welcome your interest this morning. You are joining us for the Medicare Made Easy, the ABCDs of Medicare. I am a licensed health insurance representative for the state of Massachusetts, and hopefully we can break down some of the pieces and make some of the information a little more clear. So with that, we'll go ahead and get started. The first piece we like to take a look at is exactly how original Medicare works. So with that, we'd like folks to be aware that Medicare is a federal health insurance program. It is available to individuals who are turning age 65 or older, people under the age of 65 with certain qualifying disabilities, and anyone with the medical condition of end-stage renal disease, which is actually a form of kidney failure that requires the individual either go for dialysis or possibly a transplant. The two components of original Medicare, of this health insurance, you have your Medicare Part A, and this piece is designed to help pay your inpatient claims. So if you're admitted into the hospital, whether it's through the emergency room or a scheduled procedure, skilled nursing facilities, hospice care, and certain home health care services, this is what Medicare Part A is designed to pay for. Part B covers your outpatient services. So services like physician office visits, outpatient surgeries, routine care, physical therapy, speech therapy, anything that takes place on an outpatient basis, Medicare Part B is designed to help pay those medical claims. Now, the majority of individuals can receive their Medicare Part A upon turning age 65, and the majority of individuals don't pay a monthly premium for Medicare Part A. As long as you have worked 10 years or 40 quarters paying into the Medicare system, you can receive your Part A at no monthly premium. When you do receive your Medicare Part A, one of the first questions that comes up, if I am admitted into the hospital, what type of balances will I receive if I'm using my Part A coverage? And it's important to know that Medicare Part A does place an inpatient deductible for each benefit period. For 2023, Medicare has stated the inpatient deductible is $1,600. Now, if someone is admitted in the hospital, whether it's days 1 through 60, their balance or responsibility is this inpatient deductible. But should they be admitted longer than 60 consecutive days, they now will begin to have per day fees that accrue. The other question that often comes up, do I have to pay the inpatient deductible each time I'm admitted into the hospital? And that depends on when the last time you were admitted. The reason being there must be a 60-day break in between inpatient stays for that inpatient deductible to apply. Example, perhaps someone's admitted into the hospital for, a couple nights a week. They will come out and will receive a bill from the facility for their $1,600 inpatient deductible. And now let's say 4 or 5 months goes by and they wind up getting readmitted, whether it's for the same condition or another condition. They would not pay they would pay another inpatient deductible because longer than 60 days has lapsed in between the last hospital stay. Now, moving to the Medicare Part B, the outpatient coverage. This piece is a little different. Individuals are required to pay a monthly premium for their Medicare Part B. If an individual is collecting their Social Security check at the time that they sign up for their Medicare Part B, Social Security will automatically withdraw that monthly premium. The majority of individuals are being quoted in 2023 $164.90 each month. However, it's important to know that Social Security does go by your annual gross income. So if an individual is grossing more than $97,000, their Medicare Part B premium will be higher than $164.90. And this is where we refer individuals back to Social Security directly, as they have a chart based on the individual's last 2 years' tax filings, which would then coordinate to what they would be quoted for their Part B premium. If an individual is not collecting a Social Security check, it certainly doesn't mean they can't sign up for their Part B at age 65. It just means they will receive a quarterly bill from Social Security for their Medicare Part B premium. Now, likewise, to the Part A, Medicare Part B places a one-time annual deductible. So the first time the individual uses their Medicare Part B, they will be responsible for the first $226 of their medical claim. And again, each year, Medicare sets what the new Part B and Part A deductible will be. So for 2023, it's $226. And after the individual has satisfied the $226 for the calendar year, Medicare Part B will pay 80% of Medicare's allowed amount for that outpatient visit, but always leaving the individual with a 20% leftover balance. Now, some routine care preventative services may be covered at 100%, so the individual may have no member responsibility. Now, this graph or chart contains for what you pay in 2023 for your Medicare Part B. So this is a quick glance based on whether the individual files their taxes on an individual basis, jointly, file married but with a separate tax return. You can see the ranges. And certainly as the individual's tax amounts go up, or their gross income, you can see based on this chart, in turn, their Medicare Part B premium, monthly premium, also goes up. For any questions relating to your Part B premium, again, we refer individuals back to Social Security directly. Original Medicare and adding some additional coverage. So this slide gives us the three main ways that we see individuals using Medicare. The first slide, we see individuals that certainly use just their red, white, and blue Medicare A and B for their health insurance. They obviously have hospital coverage and outpatient coverage. But it's important to note that the original Medicare card does not cover prescription drugs at a retail pharmacy. So individuals that are using just their Medicare card will need to purchase what's called a standalone or separate Part D prescription drug plan. These are only through private insurance companies, and although the federal government sets up the phases and mandates the rules, you can only attain Part D prescription drug coverage through private insurance carriers. The next bar shows the second way we see individuals using Medicare. And again, they use their Medicare A and B as their primary insurance. They purchase a separate Part D drug plan, but these individuals want a plan that helps them pick up the balances that Medicare A and B leaves over. So they will purchase something called a Medicare supplement or a Medigap plan. And that's exactly what this type of coverage does. It comes in after Medicare pays its portion and can help pick up these balances. The state of Massachusetts allows the carriers to offer 3 varieties of supplement plans, and we'll go over these later in the presentation. The last bar you're seeing is the final way we see individuals using Medicare. And again, they have Medicare A and B, but they use something or enroll in something called a Medicare Advantage or a Part C plan. And again, these plans are only through private insurance carriers. Unlike the supplement plans, the Advantage plans do not work with the Medicare A and B. They take the place of Medicare. So you must enroll in Medicare A and B to be approved in an Advantage plan, but then you tuck the Medicare card away. You can place this in a drawer. You no longer are using your Medicare card, and you are only using the Medicare Advantage plan through the private insurance carrier. These plans include the Part D prescription drug coverage. What happens is you've tucked the A and B card away, and Medicare now has, or rather reimburses the Advantage plan for taking on all the risk of your care. You, in turn, no longer go by Medicare's deductibles and 20% coinsurance. You now go by the set copays that are under the Advantage plan that you choose. These plans are similar to employer group plans where you're using just the one card. Ultimately, the next question we get, if I'm not going to be using my Medicare card, do I still have to pay my Medicare Part B premium? And the answer is yes. You still must pay your Part B to Social Security directly. But again, you've tucked the A and B card away and only using the Advantage card. Original Medicare and Part D prescription drug coverage. So Part D prescription drug coverage, as I mentioned, is only available through private insurance carriers. If you're someone using the original Medicare card, you purchase what's called a standalone Part D plan. But if you're enrolling in a Medicare Advantage plan or a Part C plan, you're not allowed to purchase a separate Part D plan. You must choose a Medicare Advantage plan that includes the Part D coverage. All Medicare Part D plans must follow the federal drug program guidelines. And this is very different drug guidelines than most employer group plans or non-group plans include. How does the Part D prescription drug coverage work? Well, for 2023, and I apologize, our slide is indicating 2022, but these are the guidelines that pertain specifically to this year, 2023. And these phases that you're seeing are mandated by the federal government. The insurance carriers that offer drug coverage must follow these. And basically, if you're offering a Part D prescription drug plan, you can place a pharmacy deductible in, and you can make that deductible as high as $505 for 2023. That doesn't mean every Part D plan makes it this high. So this is a piece of information that you look at as you're shopping for plans. What did the carrier place as their pharmacy deductible? Then Medicare places or gives us what's called an initial coverage limit. For 2023, the federal government states the coverage limit is $4,660. We often refer to this coverage limit as a spending limit for the cost of your prescription drugs each year. It's like an imaginary bank of money given to you right when you enroll in the Part D drug plan. Now, as folks go and fill their prescriptions, they may have to satisfy a pharmacy deductible first, and then they begin to pay their copays in this phase. But it's not the copay they hand the pharmacist for their medication that gets subtracted from this coverage limit or spending limit. It's what the true actual full cost of the medication is. So, as an example, perhaps someone is filling their medication and this medication has a $45 copay. So they pay their $45 copay, but it's not 45 that's subtracted from this 4,660. The pharmacist sees on his screen the true actual cost of the medication is $375. It's $375 that is deducted from this coverage limit. Each time the person is filling a medication, whatever the actual cost is through the carrier is deducted. You can begin to see that for folks that either take quite a few medications or very expensive medications, they may use up this coverage limit prior to December 31st till the end of the year. For individuals that use up the coverage limit prior to the end of the year, they then enter what's called the next phase, the coverage gap. Or in past years, this was referred to as the donut hole. And if someone enters this middle phase of the gap, they no longer pay the copays they were previously paying. Now in the gap, they are asked to chip in 25% of the actual cost of the medication, 25% for brand name drugs and 25% for generic drugs. Now, for individuals that may qualify for what we call a low income subsidy through Social Security, they may not be subject to this. But for individuals that do not receive this assistance, they are now chipping in 25%. There are many folks, just to advise, that do not use up the coverage limit, especially if they're mainly taking generic drugs. Some folks may get in this gap the last couple months of the year, so they're chipping in 25% for a few months. Others enter this gap much more quickly based on the real cost of their medicines. And in this gap, if someone satisfies out of their own pocket $7,400, that includes any deductible that was paid, any copays they started with, and any percentages they've paid in the gap. And maybe it's now September, and their statements reflect they have paid $7,400 in prescription costs. Then they come out of the gap to the bottom final stage, catastrophic coverage, where now their copays have dropped, or they're chipping in 5% rather than 25%, whichever is the greater. And then, of course, each January, the government gives us the new numbers and this all resets. So as we mentioned, this is very different than most folks have become accustomed to when they've been working full time or perhaps purchased a non-group plan. Now, there is something called the Medicare Part D late enrollment penalty, because often when we speak with individuals, they may indicate upon taking their Medicare A and B, I'm not going to purchase Part D prescription drug coverage. I don't currently take medications, or my out of pocket for my generics is extremely low. It's important for us to note that unless you have a veteran's benefit, you use the VA for your prescriptions, or perhaps a military benefit through TRICARE or some type of retiree benefit, the government mandates you do carry Part D prescription drug coverage. And for those individuals that don't purchase it upon taking their A and B, but perhaps wait a year, 2, 3 years, they are assessed a monthly penalty when they do enroll. The way the penalty works is Medicare takes whatever the national average is of a Part D drug plan, and right now we say about $34 a month for a separate Part D drug plan. So they take 1% of that, 34 cents, and they times that 34 cents by the number of months or years the person did not carry a Part D drug plan. Whatever that dollar amount is then tacked on to their premium. The way it stands right now, this is a lifetime penalty. Each year, the penalty can be raised because the cost of a Part D plan can also go up. We want folks to just be aware this penalty exists as they're determining what type of coverage they're going to purchase. Now, if you are an individual working beyond age 65 and you are keeping your credible employer group coverage, you don't have to worry about a Part D late enrollment penalty because you're carrying credible prescription drug coverage. This penalty would apply to individuals that have A and B, no employer group coverage or other form of coverage, and just have continued to not carry a Part D drug plan. Now, original Medicare, we've talked about adding a Part D drug plan and purchasing a supplement. Supplement plans, it's important to note that, again, you must have your Medicare A and B, and a supplement is going to come in after Medicare pays its portion and help pick up the balances. Now, you will have a monthly premium for a supplement plan. And as I mentioned, there are 3 individual supplements available in the state of Massachusetts. But supplements are not just for individuals 65 or older. If someone has a qualifying disability, 24 months of disability, and has been awarded A and B, and they've been awarded that due to a condition other than end-stage renal disease, then they too are eligible for a Medicare supplement plan. We mentioned Medicare is primary, supplement secondary. Supplements fill in these gaps, and you can also use any provider that accepts Medicare A and B. So you don't have a provider network with supplement plans. As long as that facility, physician, hospital accepts Medicare, your supplement can come in and help pick up the balances. But again, you have to purchase a separate Part D prescription drug plan. Now, many other states offer supplement plans that are standardized A through N. However, Massachusetts is a little easier because, as I mentioned, we have 3, the Supplement Core, Supplement 1, and Supplement 1A. So the Commonwealth of Massachusetts does not follow the standard supplement plans A through N. However, Connecticut does, and a good majority of states do. Now, eligibility. If I decide I prefer a supplement style plan, who can enroll in each of the supplements? Well, the Supplement 1 right off the bat is a grandfathered plan. And in order to be eligible for the Supplement 1, you do have to have turned 65 or gained Medicare status prior to January 1st of 2020. So if you don't fall into this category, you now have a choice of 2 supplements, the Medicare Supplement Core or Supplement 1A. And anyone with Medicare A and B is eligible for either of the supplements. These also have a continuous enrollment, meaning I can join the core supplement, and let's say 2 or 3 months later, I want to make a change. I can jump into the first of the following month, the Supplement 1A. So I can go back and forth between these supplements as long as I'm enrolled in one of them. Now, What are the differences in the different supplements? Well, you have your core supplement plans, and the core supplement plans don't pick up every balance that Medicare leaves over. Remember, we discussed if you're admitted in the hospital, the Part A leaves you with a $1,600 deductible. Well, the core supplement won't pick up that deductible. Skilled nursing, the first 20 days in a skilled nursing facility is covered in full. However, days 21 through 100 institutes a per day fee. Well, this core plan won't be picking up those per day fees. It also will not be picking up your $226 Part B deductible. Certain plans may add additional benefits, and premiums may vary based on the carrier. Looking at the 1A, now this plan normally costs a little more, but it's going to pick up more categories. It is going to pick up the inpatient deductible, skilled nursing per day fees after 20 days, but you'll still be responsible for your Part B deductible. And then the supplement 1 picks up all the different balances as long as it's a service that Medicare covers. And that's important to note, because if Medicare does not cover a particular service, the supplement won't be picking it up either. Now, original Medicare and choosing a Medicare Advantage plan. We mentioned these Advantage plans are a little different than the other plan, the supplement, because again, we mentioned you do have to have A and B, but I've determined I like an Advantage style. You've tucked this card away. You are only using the Advantage card. This card is certainly going to cover you in the hospital, so it's taking care of your Part A. It's going to cover your outpatient services, Part B. You can, or rather the carrier can add additional benefits in, things that original Medicare does not cover. It adds the Part D drug coverage in as well. You can have HMO plans and PPO plans, and we'll go into a little more detail. Eligibility. What do I need if I determine I think an Advantage plan is the best fit for me starting out? Well, you must have both A and B, but now I have to live within a certain service area. And based on which plan you're looking at, you need to know what those service areas are. Medicare Advantage plan highlights. So generally, most Advantage plans have a fixed premium that you pay to the carrier, although many of the plans also have $0 Advantage plans. So you're paying your Part B to Social Security, but if you choose a $0 plan through the carrier, you're not making obviously any payment for the plan to that carrier. PPOs, I can go out of that carrier's network. HMOs, I have to use the providers in the network for scheduled services. HMO and POS, point of service, again, in and out of network. And certain plans may also offer PFFS, private fee for service. Most of the Advantage plans have a yearly out-of-pocket maximum, so I have a safety net that if I reach a certain dollar amount of medical copays, at that point, the plan kicks into 100% coverage. I may be responsible for copays for a variety of medical services. Generally, if it's an HMO, I have a specific service area and network of providers. Most Advantage plans do offer you worldwide emergency coverage with a copay, and many plans include additional extra benefits, things that original Medicare does not offer. Things like perhaps over-the-counter item allowances, some dental services, fitness, Weight Watcher, hearing services, perhaps hearing aids. eyewear, routine eye coverage, eyeglasses, home delivery meal services. There's a variety. And again, these are services I'm looking at as I'm determining which plans fit my needs. Now, important considerations to think about as I'm choosing for or shopping rather for a plan, whether it's a supplement or an advantage plan. So you'll find many different options out there. Some of the ideas that folks think about as they determine what will fit my needs best. Again, I like to travel. What plan's going to cover me as I'm traveling throughout the US or out of the country? I mainly use providers within a certain network, so I don't plan on being out of the service area. Perhaps I like to use providers out of Massachusetts. I already have established providers in Vermont, Connecticut. Additional benefits. I do use particular gyms or have certain dental services that I need covered or reimbursements that I may need. What type of monthly premium is affordable? Monthly premiums times 12 months based on what the level of copays look like. These are the services I use each year. Let me chart out based on if I choose this plan, this is what my copays would total. Provider networks. Formulary, meaning let me request this particular company's medication listing. Are my medications covered? What are the deductibles with this plan? What are the copays with this plan? What are some of the extras, as I mentioned, built in? Customer service. Am I able to reach someone? Is there a sales individual that I can work with on an individual basis? When and how to enroll in Medicare, because there's only certain times of the year that I can enroll with certain plans and certain style plans. The first one, as we know, if an individual is signing up for Medicare, perhaps they are someone upon 65 that has determined I am taking my A and B. Medicare says we're going to let you start this process 90 days prior to when your A and B starts. And as a general rule of thumb, most folks are eligible for their Medicare A and B in the month in which they turn 65. Never mid-month. Your A and B is effective the first of the month in which your 65th birthday falls. And if you're someone that determines I'm not sure if I'm going to sign up for A and B for that month, Medicare says we're going to give you 3 additional months after your 65th birthday to determine if you would like to sign up for the A and B. Now, for folks that are continuing to work full time, other than perhaps if they are a sole proprietor, if they're going to continue to work, they may keep their employer group coverage. And they don't have to sign up for their Medicare Part B, and they will not receive a penalty. Now, if you are a sole proprietor and you have no employees under you, Medicare does have a rule that you are required to sign up for your A and B for the first of the month in which your 65th birthday falls. Another quick note. If you are someone collecting your Social Security prior to age 65, you will automatically get a packet. Social Security has signed you up for your A and B. It doesn't mean that you must take it, but you will get a packet with your A and B card within the packet. Also with a letter that indicates if you do not want your Part B, to X off a particular box and mail the form. But this is an automated process for folks that are collecting Social Security upon age 65. You are able to sign up for A and B either through the Social Security office directly. You can set up an account online. You can call them. And sometimes folks are also able to set up either telephone appointments or meet with an individual at their local Social Security office. Important enrollment dates. So we mentioned the first election, and that's when somebody is newly eligible, right at their 65th birthday. We mentioned that 7-month period that you can start the process signing up for your A and B 3 months before. Now, that doesn't mean your A and B starts 3 months before your 65th birthday. It just means you can go online, call, you can work on setting the A and B up. The earliest the A and B can start again is the first of the month in which your 65th birthday falls. Or again, you have those 3 additional months after turning 65. And that's the chart that you're seeing, my 7-month initial enrollment period. Then you have something called the general enrollment. This is for individuals that perhaps took their Medicare Part A, did not sign up for Part B, and do not have employer group coverage. They basically only have Medicare hospital coverage. And perhaps for the first 6 months, year, that's the only medical insurance they had. Medicare says you can't sign up whenever you want for Part B, but you can sign up between this general enrollment period. And they have adjusted it slightly so that you can sign up for the Part B, and the Part B will take place the first of the following month. In other words, it does not any longer, they just changed this, run from January 1st to March 31st. And again, keep in mind, if you are someone working past the age of 65, you are entitled to a special enrollment. You have credible coverage, and a good 60 days before you're going to retire, you have a qualifying reason to go back to Social Security and sign up for your Part B. And I believe that's on a few slides further. This next election period is called the annual enrollment, and this time frame runs in the fall between October 15th and December 7th. For anyone that already has A and B, whether they only use A and B, whether they're in a supplement, whether they're in an advantage, they can make any change they like between these dates. The change would then take effect that January. So as an example, perhaps someone is only in original Medicare and determines, now I do want an Advantage plan. I've been using the A and B for a while, and that's the only coverage. Well, between October 15th and December 7th, you can choose an Advantage plan and do the enrollment, which will then take effect for that January. Maybe I'm in an Advantage plan and I no longer want that coverage. I can disenroll and go into a supplement plan. Again, that change won't take effect till January 1st, but I make the change between this October 15th to December 7th. And this is why you see so many commercials, mailers. Quite frankly, folks are deluged with mail. Each of the carriers wants you to reevaluate your situation and determine what's going to be the best plan for me for the following year. Now, we mentioned the loss of employer group coverage. This is a common special enrollment we see as time goes on. Folks working beyond the age of 65. And again, they want to start this process a good 60 days before they lose their credible employer group coverage. There are specific forms that must be completed by the employer as well as the beneficiary. These forms then go to their local Social Security office. And again, they want to start this process a good 60 days before they're losing their employer group coverage. Once someone retires, technically they have 8 months from losing the employer coverage to sign up for the A and B without penalty. However, you only have 2 months or 60 days from the loss of employer group coverage to enroll in an Advantage plan and prescription drug plan. So we normally do not recommend folks to go an 8-month time frame. Normally, they want to have their Part B, ready to go for the first of the month after they've lost their employer group coverage. As we mentioned here, they're even saying a good 90 days prior to retirement date to begin to get these forms complete and sent over to your local Social Security so that your Part B, as we see most folks still sign up for Part A right at 65, there's no cost to them, but they may hold off on the Part B. But we want that all set up for them as they begin to choose whether they want a supplement or advantage plan. Now, other special enrollments other than losing employer group coverage. If you move in or out of a service area, that triggers a special enrollment. Leaving or gaining employer coverage, moving in or out of a long-term care facility or nursing home, folks that qualify for what's called a low-income subsidy, individuals that have what's called a state pharmaceutical assistance program can make a one free change in the year, or if a particular carrier is rated as a 5-star plan, an individual can move from their carrier to the 5-star plan in that year. Tools to help you shop. So different avenues to look at. As you receive your Medicare A and B, every year you will receive a Medicare and You booklet, which comes directly from Medicare. This again confirming types of coverages, plans in your area, pricing, star ratings. This is an excellent tool to begin with. You may also, as you look at this, go through the various plans, but you can always also go, another excellent tool is the Medicare website directly. Again, you can shop for plans. You can even input medications. There's an area where the website can help you choose perhaps what Part D plan saves you the most based on your specific medications. You certainly, as you're looking at the individual carriers, can work with an insurance agent or a health representative. A lot of local senior centers offer what they call Shine representatives. These are individuals that can compare side by side the various carriers, whereas an individual agent through a specific carrier can only speak to their plan specifically. Again, this chart is giving you the agency name, phone number, website, some of the detailed information that they can help with, and then how to contact us. So Health New England specifically, if you're someone that perhaps is in the process of either retiring or just turning 65 or may think you have a qualifying event to enter a Medicare plan, we have our Medicare sales manager, Sarah Fernandez, my co-associate, Carla Figueroa, myself, Kerry Trotta. We have Lee that handles our Berkshire area, Fern Silva, and Michelle Eldridge as our team. So we also have indicated here, specifically, if you find, gee, I do have further questions or at a later date would like to outreach, I will give you a moment, certainly, to indicate my direct phone number, my email address. And then these are just some general numbers, our website address. And then even if you would like to shoot a quick email with questions, we have a support box. Normally, this is where I hold off for a few moments. I know at the beginning, Sue mentioned we have a chat box on the toolbar. So if you have a brief question that you need clarification on, please feel free to jot your question in the chat box. I'd be glad to address that. If you find, gee, I have quite a few more detailed questions or very individual questions, please feel free to outreach. And the other thing too, we have materials available if specifically you are looking at Health New England's coverage. We have kits, and we also have a sales presentation which outlines our plans in particular for 2023. So with that, I'm going to hold off for a moment or two, giving individuals a chance, if they do have a question, to jot it in our chat box.
Just want to say great job, Kerry. Thank you. Really terrific stuff.
So
much
excellent.
Information.
Yes, yeah, we know it's a lot of detailed information. And I do see here, just quick question can we get a copy of the slides used today? And I believe I would have access through Sue to email addresses to send this as an attachment, if that's a help. Be glad to do that. Is that the case,
yeah,
Sue?
Yeah, absolutely. Yep. I can definitely email anyone that would like the slide deck. You will get a survey. The attendees will get a survey, and they can just make a note that they would like to get a copy of the slides. We're also recording this, and so we will have this on our website and on our YouTube channel, youtube.com/Bay State Health. And I'll put it on the senior class page, the Bay State Health senior class page. So,
excellent.
And I can actually email it to people. So we have a number of options to kind of review all this great information again, should they need it.
Excellent. And certainly if you're on any time frame or looking to have this particular slide or a Health New England presentation or plan specifically, please feel free to give me a call or outreach, and I'll send it within hours. So, yep, and I see a comment. That would be wonderful. Yep, she would like to receive the slides. So again, we certainly appreciate your interest today, and if we can be of any further assistance, please feel free to outreach. Thank you for joining us.